Welcome to Bloodborne Pathogen Training for Volunteers. My name is Margaret Russ. I work here in the Quality Department in the Christiana Center. Thank you for being a volunteer at the Blood Bank of Delmarva. We appreciate all you do to help us. We are bringing you this presentation for you to know more about the potential risk with blood exposure and to make sure that you don't touch any blood. You leave that to the employees who will have the appropriate personal protective equipment. Our objectives for this training are to define bloodborne pathogens, discuss examples of bloodborne pathogens and how they're transmitted, define occupational exposure, explain BBD's exposure control plan, and what this means to you, a volunteer here at BBD. Why bloodborne pathogen training? BBD's employees' potential for occupational exposure. It's the law, 29 Code of Federal Regulations, Part 1910, Occupational Safety and Health Standard, otherwise known as OSHA, and employers shall institute a training program and ensure employees participate in the program. Well, now, as volunteers, you're not an employee, but we want to make sure you understand about bloodborne pathogen. Now, the standard for bloodborne pathogen places requirements on employers whose workers can be reasonably anticipated to come in contact with the blood. It prescribes safeguards to protect workers against health hazards caused by bloodborne pathogens. The requirements address items such as exposure control plan, universal precautions, engineering and work practice controls, personal protective equipment, hepatitis B vaccination, and post-exposure follow-up. So what are bloodborne pathogens? They're microorganisms that are present in the human blood and body fluids and can cause disease in humans. Some examples of pathogens include hepatitis B, hepatitis C, and HIV. And they can produce chronic infection. They're transmittable in the healthcare and allied health settings. And volunteer blood donors present a lower risk than most because we test their units of blood every time they come in. We still don't know until we test it at each donation whether they are actually free of any of these bloodborne pathogens. So we have to treat them all as if they are infected. Now, bloodborne pathogen, the hepatitis B virus, is the most contagious of the common bloodborne pathogens. Hepatitis C virus is the most common chronic bloodborne pathogen in the United States, and HIV is rare, fewer than 200 U.S. cases per year. The modes of transmission are very similar within the bloodborne pathogens. Of course, exposure to the infected blood and body fluids. Occupational exposure, such as an injury with a contaminated needle and the sharps, and they can survive on the countertops and cause infection. Now, ways of transmission that wouldn't happen here would be if you got it infected from a blood transfusion or sexual contact or IV drug use. Bloodborne pathogen standards requires employees to observe universal precautions to prevent contact with blood or other potentially infectious material, OPIM, to treat all blood and other potentially infectious material with appropriate precautions such as the use of gloves, masks, and gowns if blood or OPIM exposure is anticipated, and use engineering and work practice controls to limit exposure. Now, for both employees and volunteers, it's important to cover any cuts or breaks in the skin while working to keep yourself protected. Now, with the volunteer training, I want to make sure that you know what personal protective equipment is. It is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses, such as wearing gloves and lab coats, face shields, and countertop splash shields. These are used within the 2 labs that we have here, making sure that no exposure to blood will happen. Occupational exposure is reasonably anticipated skin, eye, mucous membrane, or other contact with blood or other potentially infectious material that may result from a performance of an employee's job duties. So labels and signs that you'll see throughout our locations. Biohazard waste containers. They're used for regulated waste, contaminated personal protective equipment, PPE, or sharp containers. Containers that contain regulated waste, as well as refrigerators, freezers, and other devices containing blood or OPIM, must display the biohazard symbol and be stored in a secure, restricted area. Labels should be fluorescent orange or red-orange with lettering and symbols in a contrasting color. Now, with our labels and signs, there's an exception for blood products. Individual containers of blood components, or products that are labeled as to their content and have been released for transfusion or other clinical use need not be labeled as biohazard. So if you see this picture right here, this is a unit of blood that's ready to go to a hospital for transfusion. So there's nothing on here that says it's biohazard because we know that it's ready for transfusion. It's perfectly safe for a patient to get. Individual containers of blood, or OPIM, need not be labeled if placed in a labeled container for storage, transport, shipment, or disposal. And this is a picture of our blood boxes. So these are when we ship any component of blood, it goes in a box with this type of outside on there. So it just says human blood, and it's not biohazard at this point. Thank you for being a volunteer here at the Blood Bank of Delmarva. You are a big part of the donor experience. We miss those of you who had to leave us during the COVID-19 stay-at-home period. Welcome back. We truly missed you. And for those who are joining us for the first time, thank you for being a volunteer and welcome aboard.